All right, we're going to begin this hour with some promising news in the fight against dementia. There's a new study out. It says that the latest shingles vaccination may also delay the illness of dementia. Researchers found that people who got that vaccine lived, on average, 164 additional days without a dementia diagnosis. This is compared to those who got the previous shingles vaccine, so very similar population. That's according to a study published in the journal Nature Medicine, peer-reviewed, top-shelf stuff. We're joined now by Dr. Celine Gounder, a CBS News medical contributor and editor-at-large for public health at KFF. Dr. Gounder, good morning. It's always weird to me to use my brain to have a conversation about protecting my brain and the health of the brain, because I don't like thinking about the body, and I particularly don't like thinking about dementia. So I'm excited by these results, and it sounds like you are too.
I am. The fact that we have a vaccine that's already approved, already out there, covered by insurance, super easy to get. The fact that that is showing this kind of level of protection is really promising for a lot of folks.
What's the theory for why it might have provided this protection?
Well, the shingles vaccine protects against the reemergence of the virus that causes chickenpox. A lot of us get chickenpox as kids. It goes into hibernation, basically, and then comes back out as shingles. But what may be happening in terms of how it causes dementia is during that hibernation period causing perhaps low levels of damage or inflammation in the brain and the nervous system that eventually over time causes dementia.
So can it prevent dementia altogether?
It does seem to delay. We don't know that it prevents, but the degree to which it's delaying dementia is on the same order of these new, very expensive medications for Alzheimer's disease that you don't give until you start to develop symptoms. So this is something that if you can just altogether prevent and delay any symptoms much more cheaply, easily, that's a really big, promising change.
So should everyone try to get the shingles vaccine to delay dementia?
Well, right now, the CDC already recommends that everyone get the shingles vaccine starting at age 50. It's 2 doses. I think the real question before us now is, should we be starting to vaccinate even earlier?
Maybe.
Will you need more doses if you start vaccinating earlier? We don't have answers to that yet.
Are there other ways for morning television anchors to prevent dementia in later life?
Crossword puzzles.
It's a lot of the things that we would advise for everything, right? You know, you want to control your blood pressure, avoid developing diabetes through good diet and exercise, but if you have diabetes, be sure to manage it well. Quit smoking. And another new, unfortunately, risk factor is wildfire smoke. And so if you think about what's happening out west, you know, try to minimize your exposure, get some indoor air filtration units. If it's really bad, you might want to be wearing a mask outdoors during those periods of time.
Oof, okay.
I would have never thought about that. Dr. Gounder, thank you so much.
Thank you very much.